Good evening, everyone. Thank you so much again for joining us tonight for our fourth live event with Rothman Orthopedic Institute Foundation for Opioid Research and Education. Tonight, we have joining with us again Dr. ASIF ILYAS, who is the president of the Rothman Orthopedic Foundation. We are also welcoming tonight Dr. Frederick LISS, president-elect of Physician Hospitals of America, secretary of the AAOS PAC committee, and also an associate clinical professor at Thomas Jefferson University. We're also going to be welcoming Mr. Jonathan BIGLEY, who is a partner with BIGLEY and Blickle, a law firm that specializes in government relations, where he also serves as counsel for the Pennsylvania Orthopedic Society. Gentlemen, welcome. Thank you so much for joining us tonight to discuss this ongoing opioid epidemic and how it crosses paths with politics.
Thanks, Sam.
Thank you.
Dr. ILYAS, I'd love to start with you.
Sure.
You, having previously served as president of the Pennsylvania Orthopedic Society, that probably gives you some perspective on the crossroads between public health and politics. How do you see the opioid epidemic being received in the political arena?
Thanks, Sam. That's a great question. And indeed, my time serving on the Pennsylvania Orthopedic Society board, and including just recently, I've completed my term on the presidential line. My 4 years on that presidential line intersected directly with the opioid crisis in Pennsylvania. If we go back to 2016, that's where in Pennsylvania we saw a significant increase in the numbers and rate of opioid-related deaths in Pennsylvania, which was off the curve relative to the rest of the country. So the whole country was experiencing the opioid crisis, but Pennsylvania started to leave that curve in a bad way, where we were seeing disproportionate amount of deaths throughout the state. So at that time, we were in a position, and I was in a position to observe the engagement by our political leaders, our policymakers, and also we had the opportunity as healthcare professionals involved in advocacy to work with them, to inform them, to come to some evidence-based policy solutions, etc. And that was really helpful for all of us in terms of both getting to know each other and also seeing what we can do when we get together. And some of the things that we did, firstly, the legislators and the governor did a number of things, including put limits on the amount of opioids that could be prescribed, particularly out of the emergency room, particularly to minors. Rules were changed around medical opioid prescribing, medical schools, access to clinics for opioid addiction, etc. Where we got particularly involved with was new laws. For example, we championed the prescription drug monitoring program across Pennsylvania, so that we were able to monitor patients' prescriptions for opioids, and more importantly, make sure that they're not doctor shopping or taking them excessively or mixing them in manners that are dangerous. And the other major legislation that we worked very hard with the state to champion was the opioid e-prescribing legislation, which allowed us to now prescribe opioids electronically to avoid the issues related to hampering, manipulation of paper prescriptions, avoided the need to overprescribe on a paper prescription because they couldn't get more opioids unless they were seen in person, and other such complications to paper prescribing. Now, for the past year plus, we have been e-prescribing with great success, and that was, again, one of the ways that we intersected with politics in a very positive way, and that engagement continues.
That's great. That's great. I'd like to move on to Mr. BIGLEY. As counsel to the Pennsylvania Orthopedic Society, you are keenly aware of the politics in Harrisburg and Pennsylvania's opioid epidemic. How have our politicians responded, and where are there ongoing areas of collaboration and expansion of policy to further positively impact this ongoing crisis?
Well, thank you, Samantha. First, I'd like to start with a little bit of history. Over the last two legislative cycles, we've seen a tremendous number of opioid-related pieces of legislation introduced in the General Assembly. Fortunately, most of those did not become law. And I say fortunately because many proposals were not based in science, but were based in a reaction to the opioid addiction crisis and what the General Assembly thought was their need to act and act quickly without regard to any kind of unintended consequences that may occur. And I'll give you an example from the 2017-2018 legislative session. In that session, as Dr. ILYAS mentioned, there was legislation to limit the number of days that opioids could be prescribed. And while as the advocate for the Orthopedic Society and the patients that orthopedic surgeons serve, I would take evidence-based and scientific-based information to the General Assembly, to legislators, to their staff, advocating that a one-size-fits-all solution is not appropriate, particularly for surgeons and surgical patients. Many times in that era, the reaction I received from staffers and from legislators was, well, New Jersey just passed a 3-day limitation on opioid prescribing. So that sets the new standard, 3 days. And I would say to these folks, that's not based in any kind of reality. It's not based in science. It's not based in the needs of patients, particularly surgical patients. Fortunately, the Orthopedic Society stayed engaged throughout that whole process. And ultimately, we were able to gain a surgical exception to that prescribing limitation legislation. It was through that engagement that we were able to get a solution that would actually work for patients and for physicians, particularly surgical patients. So the point of that story is to let you know that the General Assembly will act. They will engage in crises such as the opioid addiction crisis, but they may leap far too quickly and create problems in their wake. And that's where the Pennsylvania Orthopedic Society has to stay engaged. And frankly, the Rothman Opioid Foundation should engage and stay engaged, bringing forward evidence-based and scientific information to policymakers before they make mistakes. Now, the current legislative session ends this month, and the new legislative session will begin in January. And it's incumbent upon the Rothman Opioid Foundation and PA Ortho to begin to engage the new legislative leaders, because we have several new legislative leaders in the 4 legislative caucuses, the committee chairs who will be named very soon, and re-engage with our legislative champions, the folks that have been carrying our issues forward over the last 3 to 5 years. So now's the time for all of us to engage the General Assembly with science, with evidence, and with solutions that work for patients and physicians.
That's great. I completely agree. These successful collaborations between the health professionals and politicians, obviously there seems to be so much room to expand these efforts, which is wonderful. Moving on, Dr. Frederick LISS, as president-elect of the Physicians Hospital Association, how have you seen hospitals approach the opioid epidemic, and what do you see on the horizon? Uh-oh.
I think you're muted, Fred.
I was going to say sorry about that. It's a perfect segue from what Jonathan just spoke about, because there are really 2 levels to discuss. One is on a state level basis and one is on a national basis. So Physician Hospitals of America is a national organization. We connect with over 200 physician-owned hospitals in the country. These are hospitals that are founded by physicians. So the same people that run the hospitals are the very same people that treat the patients. And this is a really beautiful match made in heaven for treating types of problems like opioids. So, for example, in Pennsylvania, we have 9 physician-owned hospitals. In the United States, there are over 200. We are working on a program to link all these hospitals and have hospitals be able to control with evidence-based information and do prospective, which means to study the opioid usage post-operatively after surgeries, going forward as prospectively, to really monitor how much pain medication we are giving to patients after major operations such as total hip replacement, total knee, after fracture surgery, after in some of our hospitals are multi-specialty, we have ears, nose, and throat, OBGYN, et cetera. So the doctors are able to monitor their patients in their hospitals in a way where all the goals are aligned. So when you have doctor and patient and hospital working together on the same team, it's very easy to manage because my patient's best interest is the best interest of myself and my hospital. So when we're monitoring opioids, for example, the hospital systems that we have out there throughout the United States, we're able to put together a program which we've actually been working on with the Center for Medicare and Medicaid to try to propose a plan whereby we will, in a quality-oriented fashion with evidence-based information, monitor the amount of opioids that are used and use that data to then turn around and say, hey, yes, we take responsibility for this. And, Dr. ILYAS and I have done studies together where we realized that just by counting the number of pills that we're giving to patients, realizing how much they are using or how little they're using, that we don't need to prescribe as much. So this alignment between the physicians and their hospitals and their patients has been beautiful. And in Pennsylvania, we have 9 such hospitals that are really top quality hospitals in the country. And I think we're doing a great job. These kinds of collaborations are very, very important. Collaborating with the government, collaborating with patients, physicians, and hospitals together.
That's great. As a follow-up, Dr. LISS, what kind of response have you seen among the community of physician leaders, administrators, entrepreneurs in response to this epidemic as a whole?
Well, I would say that the first word that comes to my mind is beautifully. Basically, let's take Rothman Institute, for example. I've been a doctor with them for about 9 years. As soon as the opioid crisis hit, everybody thought doctors were just scrambling to figure this out. Well, the fact of the matter is, from a political standpoint, 8 years ago, long before this became a political crisis, Rothman Institute advocacy was working with various legislators and various people, including attorneys general from around the country, who were saying to us, hey, opioids are a real issue on our radar. So that stimulated people like Dr. ILYAS and myself and my partners to start studying opioids. So there's been an early intervention there. And then when it comes to the entrepreneurial side of things, I mean, we physicians and I think Dr. Rothman would agree, we're people who stimulate, we stimulate and we sort of disrupt the medical community in a way because we bring in innovation. And so the Rothman Institute has been very early responders and actually leaders in that. So we bring it to our hospitals. We bring the issue of opioids to our practices. We have made policies inside our organization to make sure that not only are we taking advantage of the hard work that Dr. ILYAS and Mr. Bigley did on getting this monitoring system down, we use it in our practices. So it's a multi-factorial thing that works amongst all. I would say that least of all, in my opinion, have been the administrators of hospitals. I mean, I don't think they're quite as in touch as we are clinically with our patients. I think physicians who drive their practices and who are entrepreneurial in spirit and who run hospitals, those hospitals are spot on. We're more proactive, meaning we take action, versus some of the other bigger hospitals, which are more like bigger ships at sea. They react to, the environment. So that's pretty much how I see the horizon. Going forward, I would say that we're going to be leaders. We physicians like Dr. ILYAS, who founded the Rothman Opioid Foundation for Education and Research, this is something that's just purely out of the vision to really realize that we physicians have to collaborate with everybody in the community, our legislators, our patients, everybody, and do the right thing. So we're putting a big focus on it. And I think that's the horizon. The horizon is we all take part and we all become part of the solution to this massive problem.
For sure, for sure. Just to circle back, Dr. LISS, your advocacy efforts have taken you to both Harrisburg for state level advocacy as well as Washington, D.C. for federal level advocacy. So how do you perceive the impact of policies trying to combat this epidemic coming from our policymakers at both of these levels?
Well, I think the best way to answer that is to say that coalitions rule the day. Getting together with all parties who are stakeholders rule the day. Now, in the state level, we have our state orthopedic society. We have people like Mr. Bigley who are very skilled at helping guide us in how we approach the legislation. So on the state level, you know, we have a tremendous organization in the Pennsylvania Orthopedic Society that really executes very, very well and nimbly to bring important, as we've discussed earlier, evidence-based information that helps to really impact policy making. So it comes from doctors getting out of their offices and coming to Harrisburg and working with the guidance of people like Mr. Bigley and joining their organizations and really sitting down with legislators and speaking up on behalf of what needs to be done from a clinical standpoint. On the federal level, it's a little less nimble. I mean, I think at the state level, we've been very, very effective. Part of it is because the Pennsylvania Orthopedic Society is very nimble and they're very skilled at it. The federal level is a little bit difficult because you have states across the nation. We have problems that are hotspots in different areas. So, you know, Pennsylvania is a tough spot. We're part of the Rust Belt, so to speak. You know, it's like West Virginia and and Ohio and the places where the opioids really, really hammered people the worst. And so our focus here is a little different than, say, what it might be in Maine or in, Texas. So it makes it a little harder to get agreement on the federal level, but nonetheless, they at the federal level are very focused on making legislation. I think that will be a big issue coming up in the next Congress. I don't think right now, as everybody knows, they're focusing a lot on anything, but that's coming, I think, as part of the healthcare attention that's going to be in the next Congress.
That's wonderful. Mr. Bigley, to come back to you, with Rothman being a nonprofit foundation, how can nonprofits such as Rothman, as well as hospitals, universities, research organizations, engage our policymakers to drive positive change against this epidemic?
I think one of the most effective ways that the Rothman Opioid Institute can get engaged is to build upon the success that we've had thus far. And let me take a step back by saying legislative leaders, particularly legislative leaders, are constantly bombarded with supplicants who are seeking something for themselves. But to engage legislators and leaders, entities such as the Rothman Institute need to be bringing something of value to the legislators, to the legislative leadership. And you can. You have research that they don't have. You have information that they don't have. You have the science-based answer to the opioid addiction crisis that they need. And you know the impact of the COVID-19 pandemic on the opioid addiction crisis. They don't fully understand that tie-in yet. The Orthopedic Society and the Rothman Foundation has tried to make legislative leaders and committee chairs and our champions aware of this tie-in. But I think going forward, these should be twin issues for the General Assembly and the governor's office they should consider them as twin issues, and they need a joint resolution. Now, I think one of the most effective ways that we've engaged both the Pennsylvania Orthopedic Society and by extension, the Rothman Opioid Foundation one of the best ways we've engaged policymakers, both in the legislature and in the administration, is through both our two very successful opioid symposia. One was held in May of 2018, and then an even larger one was held in November of 2019. And in AI, I didn't clear this with you earlier, but frankly, Samantha, I'd like to yield some of my time to Dr. ILYAS to describe that tremendously successful opioid symposium that we held in November of 19.
Yes.
Sure. Sure, Jonathan. Happy to talk about it. Thank you for that. To just follow up on what Jonathan was referring to, in the spirit of your question, Samantha, we were looking to see how we could expand our collaborative efforts between our policymakers and our healthcare professionals, because there was a natural symbiotic opportunity here where we could both help each other. And frankly, it was very well received by both communities, the community of healthcare professionals and the community of policymakers, of legislators. And specifically what Mr. Bigley is referring to is that we held these symposiums where we had an exchange of ideas and an exchange of data and an exchange of experiences between our physicians who are in the trenches, who bring different amounts of expertise, be it from research, be it through patient care or their own policy development experiences, and then we then interface with our legislators who shared their experiences, their challenges, what they were striving to do to help their community and their state. We held the first one in May of 2018 in Philadelphia, and we held a second one in November of 2019, just recently. 2019 seems like a very long time ago now, considering the past year. But as mentioned, it was very well received. We were lucky to have the governor there. Governor Wolf was there. Secretary Levine was there. We had several dozen legislators there, and it was an excellent exchange of ideas. And I think that was something that we can continue to build on to ultimately drive what's better for society, which is moving away from this issue, combating this issue of opioid abuse, addiction, and ultimately of minimizing opioid-related deaths.
And Samantha, one of the best features of that, and I'll amplify Dr. ILYAS's comments. We had representatives of all four legislative caucuses, state caucuses, on a panel with physicians. We had the Attorney General, Josh Shapiro, to speak about the law enforcement aspects of the opioid addiction crisis with physicians on a panel and a dialogue, posing questions back and forth, looking for solutions. We had the governor, we had Dr. Rachel Levine, the Secretary of Health, on a panel with physicians to discuss remedies and solutions. It was an incredible day, and as a capstone for the whole event, and it ran 4 hours, and it was carried live by Pennsylvania Cable Network, and then repeated thereafter. The capstone of the day was a presentation by Sam Quinones, the author of Dreamland, who described in his book and in his talk the origins of the opioid addiction crisis. And he literally weaved in, since he was the keynoter, he weaved in discussion from the earlier panels into his keynote address. It was really a fantastic event. I know all of the legislators that were there very much enjoyed their participation. The governor and the secretary and Josh Shapiro, the attorney general, very much appreciated the opportunity to be with us. And that kind of engagement at all those levels of state government has positioned both the Pennsylvania Orthopedic Society and the Rothman Foundation to be both leaders and resources for the state government for the new legislative session, for the remainder of Governor Wolf's term, I literally cannot speak enough about the success of that event and how it is positioned both organizations going forward.
Wow, that is really incredible. I had no idea about these symposiums. It seems like you guys have really taken a huge step forward. Do any of you see, especially with the pandemic going on, do you see any solid steps moving forward for 2020, or at least what's left of it?
Well, at least in the Pennsylvania General Assembly, our legislative session is essentially over, and it officially ends on November 30th. So from a legislative perspective, there's no more action to be had. Obviously, the Wolf administration continues for the next 2 years, ending in January of 23. So there are opportunities in December for both the Orthopedic Society and the Rothman Institute to engage in, as I mentioned before, the new legislative leaders and the potential new chairs, the committee chairs that will be appointed after the Thanksgiving holiday. So we will have a busy December, and frankly, our work literally never ends.
Yeah, and just to add to that, sure. Sam, to what Mr. Bender was saying was, politics is all about relationship building and talking. And although the legislative session's ending in Harrisburg, it's ending in DC. There's a new Congress coming in, a new legislature coming in. There will be a lot of returning faces. We know there'll be a lot of new faces. And it's all about building those relationships, sharing the knowledge that we have, offering our services, and again, really trying to drive evidence-based policy solutions. And what we try to do, be it from a medical practice, be it through a nonprofit foundation like the Rothman Opioid Foundation, or a nonprofit organization such as the Pennsylvania Orthopedic Society, is to deliver on our reputation, our expertise, and our credibility, tools to help our policymakers succeed.
Absolutely. Now, this is a question I would actually like to take a few minutes from all of you. Dr. Liss, if I could ask you this first, just with all of the successful collaborations, obviously, that Rothman has really pinned down between the healthcare professionals and politicians, where do you see that there's room to expand these efforts?
So just to build on what Dr. Ilyas and Mr. Bigley have said, politics and policy making is all about conversation and relationships. So while the Congress is just about finished with their activity in Washington, and while in the State House it's the same, we have been having these conversations and we have relationships. And so the building on existing relationships, and we've been working with some of the new members of Congress already. I mean, Dr. Ilyas and I were on a video call with one of our Pennsylvania United States Congresswomen, and have already had a conversation about Rothman Foundation. And we hear from the Congress that they have family members who've been touched by this crisis. So I see the expansion, of what we're doing. First of all, the foundation really is a great start. I think building on conversations that we've been having for a long time and continuing to engage the new members of Congress and trying to school them on where we are, get them up to speed. Because one of the challenges that we have in policy making is that, it's a constantly changing organization of people in Washington and Harrisburg. And when you just develop a relationship, somebody may disappear or somebody gets promoted to another committee. And so it's really about hard work. As Jonathan said, it's a work that never ends. And by the way, for the viewers, I just want to say that it seems a little bit remote it did to me when I first started getting involved in political decision making. It seems remote, like, hey, I can't really do that. It's for other people to do. But the fact of the matter is we all can have conversations, and we all should. And that's what we do at Rothman, and we do it well. We established an advocacy committee. We have our Rothman Opioid Foundation. We have a lot of different activities going on. And the collective think tank is what really brings the ideas, and then we have folks who go and speak to our representatives in Washington. So I think it's an ongoing process that will grow and continues to grow, and that's our intention, and that's been our mission.
That's wonderful. Jonathan Bigley, would you like to expand on that at all?
Absolutely. I'm pleased to say that the Pennsylvania Orthopedic Society has been awarded a $946,000 Appalachian Regional Commission grant. And I'm happy to say that the Rothman Opioid Foundation is the research arm for that grant fulfillment. So the Orthopedic Society, PA Ortho, and the Rothman Opioid Foundation over the next 3 years will be working very closely with our state legislative delegations, with our congressional delegations. This is a federal grant that has state implications. So we will be working both the federal, the congressional delegation, and our state legislators, primarily in the southwest portion of the state. But this grant can touch all areas of the Commonwealth. There will be a focus in the southeast, or excuse me, in the southwest, where, as Dr. ILYAS described, the opioid addiction crisis hit the hardest. But this is a major opportunity for collaboration among PA Ortho, the Rothman Foundation, the congressional delegation, our state legislature, and the administration that's in Harrisburg now, the Wolf administration, and at least 1 year of whoever the next governor's administration is going to be. So there is a tremendous amount of opportunity for all with this grant. We certainly need to raise, PA Ortho needs to raise matching funds for this, and that work is ongoing. But we're very pleased that the Rothman Opioid Institute will be the research arm for the various fulfillment obligations that we have under this grant.
I truly hope so as well. Dr. ILYAS, if a policymaker wants to learn more about the foundation, is what they're doing to help combat this opioid epidemic, how can you guys be reached?
Sure. So as mentioned, again, this is all about conversations, discussions, collaborations. That's where I think health policy is really born out of. And, you know, our mission as a foundation, as a nonprofit foundation, is threefold. One is to educate both patients or individuals and prescribers on safe opioid consumption and prescribing respectively. Two is to perform research on opioid sparing pain management strategies, and three, to provide evidence-based policy solutions to our policymakers. So in that third mission, that third arm of our mission, it's central for us to have a dialogue with our policymakers. And our goal ultimately is to serve as a think tank for our policymakers. So if they have ideas, if they have research ideas that they want to execute, if they have data, if they are in need of data to help develop their policy solutions, if they just simply need some advice, or they want to bounce things off of us who are kind of working, on the street, if you will, to get our sense of whether it's going to work or not, or just get our feedback on different policies that have now been enacted into law. I've had some recent conversation already with policymakers about, for example, the recent medical cannabis laws that were enacted 2 years back, as well as discussions about our e-prescribing legislation, just to give them feedback. And that dialogue is necessary. So we're very easy to get a hold of. All of our information is online on our website, which is www.rothmanopioid.org. We're always accessible, and we welcome the exchange of ideas and the ongoing dialogue.
This is great. This is absolutely wonderful. To our audience, and how would anybody be able to contribute to the foundation's work if they wanted to get more involved?
Donating to the foundation is very easy. Again, if you go to our website, www.rothmanopioid.org, there's a way to very easily donate. And I always like to remind everyone relative to donations to the foundation, number one, It's a 501c3 designation, which is an IRS designation. That means that we're entirely nonprofit. So any donations to the foundation are tax deductible. Secondly, I remind everyone that the entire board and myself are doing this on a voluntary basis. We're not taking any fees for these services, so they can rest assured that the money donated to the foundation will go to execution of the different programs that we're trying to pursue to help curb the opiate epidemic within our state of Pennsylvania and then nationally and abroad.
Wonderful. Dr. ILYAS, Dr. LISS, Mr. Bigley, this has been a wonderful and enlightening discussion. Indeed, there is so much that has already been done collaboratively between our healthcare professionals and our policymakers to help combat this ongoing opioid epidemic. But I'm sure so much more can still be done. And I'm confident that with the efforts of leaders such as the three of you, that we'll hopefully be able to continue to make that impact. Do any of you have anything extra that you'd like to add before we jump off?
Just thank you. Thank you very much for the opportunity to share this important information, and it's been a pleasure chatting with you.
Likewise, thank you for the opportunity, and we thank the Rothman Opioid Institute for its good work, and look forward to working very closely with them for a long, long time.
Wonderful. Any ending words, Dr. ILYAS, President?
Well, no, I really appreciate Dr. LISS and Mr. Bigley joining. These guys are really seasoned and experienced folks when it comes to interacting with our government officials and understanding how health policy is created. So it's really an asset and a privilege for me to have access to such smart people like this, and the foundation's better for it. So thank you.
Well, me personally, I'm looking forward to seeing this difference continue. And for our audience, if you would like to help the Rothman Foundation's cause, again, please visit the website at www.rothmanopioid.org. And to learn more and donate, finding a solution for this ongoing epidemic would be wonderful. So everybody have a great night. Have a very happy and healthy Thanksgiving, and we will see you at our next live event.
Thank you.